Good day. Welcome to the POCC Trial. We refer to this study as the POCC Trial, a pilot study. Researchers from around the globe are collaborating to conduct this study, and we're happy to be hosting it in Toronto, Ontario. You have been diagnosed with COMISA, which is coexisting sleep apnea and insomnia. This makes you eligible to participate in the POCC trial. But before accepting this invitation, please ensure to read the consent form and all provided information carefully and ask any questions you may have. This video explains the POCC trial, the benefits of enrolling, and what's expected if you enroll. To begin, COMISA is coexisting insomnia and sleep apnea. It's associated with emotional, social, and physical difficulties. It's also associated with depression. The prevalence of depression for patients affected with COMISA is 42.6%. If a patient has insomnia alone, the prevalence of depression is 21.6%, and sleep apnea alone is 8.4%. So the coexistence of these two disorders increase the prevalence of depression substantially. COMISA is associated with increased irritability, increased anxiety, and reduced concentration. It is also associated with a shorter lifespan. First-line therapy for sleep apnea, according to American Academy of Sleep Medicine and American Academy of Dental Sleep Medicine guidelines, are CPAP or APAP or any of the positive airway pressures, and that pertains to severe, moderate, or mild sleep apnea. But if the patient is intolerant to PAP or prefers oral appliances as an alternative, it is a standard of care to write a prescription for an oral appliance for all severities, mild, moderate, or severe sleep apnea. First-line therapy for insomnia is cognitive behavioral therapy for insomnia. Enrolled patients will be provided access to self-administered CBTI. The name of the app is Sleep Reset. Inclusion criteria: must be an adult, must have sleep study diagnosed COMISA, it must have a healthy temporomandibular joint with a minimum of 10 healthy teeth per arch, and able to comply with the study protocol that is explained to them. As far as exclusions go, any severe psychiatric conditions, inability to consent to participate in the study, contraindications to PAP therapy or oral appliance therapy would be an exclusion, presents with a temporomandibular joint dysfunction that does not let them be able to comfortably manage wearing an oral appliance, known pregnancy or planned pregnancy in the next 12 months, and the use of any sleep medications. The purpose of the study is very clear. Although PAP is an excellent therapy with a very high effectiveness for managing sleep apnea, some patients have difficulty wearing it. And for COMISA sufferers, this non-adherence to PAP is even higher. The purpose of this study is to validate the effectiveness and adherence associated with oral appliance therapy for the patients afflicted with COMISA that cannot tolerate wearing PAP. A benefit for the patients that enroll and complete the trial are that they're not responsible for the costs of therapy that are not covered by OHIP or available extended health care plans. The patient can withdraw from the trial at any time without providing any reason, and the patients choosing to withdraw from the study will not be penalized in any way. The study involves 300 to 400 consecutive patients. Usual and customary therapies are used as per current guidelines, and your sleep physicians oversee all of your therapy. You will be offered AutoPAP to manage your sleep apnea, which is a PAP machine that ramps the pressure up and down as needed automatically. If you are adherent, you will be offered a CBTI program for your insomnia. Once complete, you will take a final in-lab sleep study. If you are intolerant to or refuse APAP because you don't feel you can comfortably manage it, you will be offered oral appliance therapy. If adherent, you will be offered a CBTI program for your insomnia, and once complete, you will take a final in-lab sleep study in order to determine the efficacy of the treatment. What to expect post-study. At 3 months and 12 months after the final sleep study, questionnaires will be filled out to establish continued benefits of therapy. Once all questionnaires are completed, your study obligations end. You will continue to be monitored by your doctors as per usual and customary protocols. Also, you retain ownership of your therapy at no cost to you. And another thing to expect, many nights of restful, peaceful, rejuvenating sleep. Our contact email is pocctrial@drviviano.com. Contact phone number is 905-212-7732. Please let us know if you would like to enroll.